Okay, let's talk about the layers of the abdominal wall. We've got quite a few. Let's start from the skin and go towards the parietal peritoneum.
All right, let's walk through the layers of the anterior abdominal wall, from the skin inward to the peritoneum, keeping it clear and concise. Starting with the skin, the outermost layer, it's thin and flexible, covering the abdomen. Beneath it, the superficial fascia splits into two in the lower abdomen. Camper's fascia, a fatty layer for insulation, and Scarpa's fascia, a membranous layer that's tougher and connects to the thigh. Next is the external oblique muscle, the outermost of three flat muscles, with fibers running downward and inward, aiding trunk movement and compression. Below that, the internal oblique muscle has fibers running upward and inward, working with the external oblique for rotation and stability. The transversus abdominis, the deepest flat muscle, runs horizontally, acting like a corset to compress the abdomen. Between these muscles, you've got connective tissue and neurovascular structures, like the intercostal nerves and blood vessels. Then comes the transversalis fascia, a thin connective tissue layer that lines the inner abdominal wall, providing support. Below that is the extraperitoneal fat, a thin layer of loose fat cushioning the abdominal cavity. Finally, the parietal peritoneum, a smooth membrane, lines the abdominal cavity, covering organs and allowing them to slide. These layers protect organs, support motility, and house structures like the inguinal canal. Want to dive into how these relate to hernias or focus on one layer's
How
role?
come the external and internal obliques come after Camper's and Scarpa's fascia but before transversus abdominis and transversalis fascia? How come transversus abdominis is where it is? Basically, I'm asking how come this is the levels and not the other way around? Because if you give them to me in a different order, I would believe you. So my question is, how come we evolved the way we did, I guess? And how we named the things the way we did too.
All right, let's unpack why the anterior abdominal wall layers, external oblique, internal oblique, transversus abdominis, and transversalis fascia, are arranged this way, why transversus abdominis is where it is, and how evolution and naming play into it, all in a clear, concise way. The layers of the anterior abdominal wall, from skin to peritoneum, are arranged for functional efficiency and structural stability, shaped by evolution to protect organs, support posture, and enable movement. Starting after the superficial fascia, Camper's fatty layer, and Scarpa's membranous layer, the external oblique muscle comes first because its downward and inward fibers provide a broad, superficial cover, ideal for flexing and twisting the trunk while compressing the abdomen. Next, the internal oblique, with upward and inward fibers, lies deeper to complement the external oblique, reinforcing rotation and lateral flexion with a crisscross pattern that adds strength. The transversus abdominis is the deepest of the three flat muscles because its horizontal fibers act like a natural corset, wrapping tightly around the abdomen to maximize compression and stabilize the core, which is most effective closest to the organs it protects. The transversalis fascia follows as a thin connective tissue layer, lining the inner abdominal wall to support the muscles and anchor them to the deeper structures, like the peritoneum. Why this order and not reversed? Evolution favored this setup because the layered, overlapping muscle fibers, external obliques diagonal, internal obliques opposing diagonal, transversus abdominis is horizontal, create a strong, flexible grid like a multi-ply wall that resists stretching, supports heavy lifting, and absorbs impacts without tearing. If transversus abdominis were superficial, its horizontal pull wouldn't efficiently compress the deeper organs, and the oblique's diagonal pulls work better, outward to leverage torque for twisting. The transversalis fascia needs to be deep to tie the muscles to the peritoneum, not superficial where it'd be less supportive. This arrangement likely evolved from early vertebrates, where segmented muscles adapted into broad sheets for upright posture and dynamic movement in mammals, balancing strength and flexibility. As for naming, external oblique is external because it's the outermost muscle, seen first in dissection, with oblique reflecting its slanted fibers.
All right, let's talk about the rectus versus the transversus abdominis and how the naming will showcase the location. Just in a sentence or two,
rectus abdominis is named rectus, meaning straight, because its vertical fibers run parallel along the midline, forming the six-pack, while the transversus abdominis is named transversus, meaning across, as its horizontal fibers wrap side to side deep in the abdominal wall. Their names reflect their fiber direction and position, with rectus superficial and central, transversus deep and lateral. Want to dive into their roles in movement or connect to the inguinal canal?
That makes a lot of sense. And we've got the linea alba between two.
Yeah, exactly. The linea alba, a tough fibrous band running down the midline, sits between the two rectus abdominis muscles, connecting them and anchoring the obliques and transversus abdominis for core stability. Its name, from Latin meaning white line, reflects its pale, tendinous look. Want to explore how the linea alba ties into the inguinal canal, or dive deeper into abdominal wall mechanics?
I want to dive into insertions and origins, which is really hard for me. So, let's start with external oblique, internal oblique, and transversus abdominis, origins and insertions. I don't understand, to be honest, what they are going to be.
All right, let's make origins and insertions super simple for the external oblique, internal oblique, and transversus abdominis. Think of origins as where a muscle starts, the fixed point, and insertions as where it attaches to move something, the mobile point. External oblique. Origin is the outer surfaces of the lower 8 ribs, ribs 5, 12, fanning downward. Insertion is the linea alba, midline, iliac crest, hip bone edge, and pubic tubercle, pulling to flex or twist the trunk. Internal oblique. Origin is the iliac crest, thoracolumbar fascia, lower back connective tissue, and inguinal ligament. Insertion is the linea alba, lower 3 ribs, ribs 10, 12, and pubic crest, working to rotate and bend the torso. Transversus abdominis. Origin is the iliac crest, thoracolumbar fascia, inner surfaces of lower 6 ribs, ribs 7, 12, and inguinal ligament. Insertion is the linea alba and pubic crest via a broad aponeurosis, compressing the abdomen like a...
So for the external oblique, I've written them down, but for the internal oblique, why it's the thoracolumbar fascia and the origin alongside? Well, I understand why it would be the iliac crest and inguinal ligament, to be fair. What about the insertion? How come it's the ribs 10 to 12 with the linea alba, the pubic crest, and the pectineal line?
All right, let's clarify the internal oblique's origins and insertions simply, focusing on why the thoracolumbar fascia is involved and how the insertions make sense. The internal oblique originates from the thoracolumbar fascia, a tough connective tissue sheet in the lower back, iliac crest, hip bone edge, and inguinal ligament, because these stable, broad structures provide a strong anchor for its fibers, which need to pull across the abdomen for rotation and flexion. The thoracolumbar fascia specifically ties it to the spine for extra support during twisting. It inserts into the linea alba, midline fibrous band, ribs 10-12, pubic crest, and pectineal line, a ridge on the pubis, because these points allow its upward and inward fibers to exert force on the lower ribs for bending and twisting, while the linea alba and pubic attachments, including the pectineal line, centralize the pull to compress the abdomen and stabilize the pelvis. Want to dig into how these insertions affect movement or compare with the external oblique?
That's okay. Let's talk a bit about the origins and insertions now of rectus abdominis and pyramidalis.
rectus abdominis originates from the pubic symphysis and pubic crest, anchoring at the pelvis, and inserts into the xiphoid process and costal cartilages of ribs 5-7, allowing it to flex the spine and compress the abdomen. The pyramidalis, a small triangular muscle, originates from the pubic crest and inserts into the linea alba, tightening it to stabilize the midline, named for its pyramid shape. Want to explore how these contribute to core strength or tie them to the inguinal canal?
So good. We also have tendinous intersections and linea semilunaris, if you could explain to me where they got their name from.
Tendinous intersections are horizontal fibrous bands that cross the rectus abdominis muscle, dividing it into segments, like a six-pack, named for their tendon-like structure intersecting the muscle fibers. The linea semilunaris, a curved fibrous line on each side of the rectus abdominis from ribs to pubis, is named from Latin for half-moon line, due to its crescent shape, marking where the oblique muscles aponeuroses meet the rectus sheath. Want to connect these to abdominal wall function or dive into the inguinal canal?
Can we talk a bit about the rectus sheath?
The rectus sheath is a fibrous envelope surrounding the rectus abdominis muscle, formed by the aponeuroses, flat tendons of the external oblique, internal oblique, and transversus abdominis. Above the arcuate line, it has an anterior layer, external and part of internal oblique aponeuroses, and a posterior layer, part of internal oblique and transversus aponeuroses, while below it, all aponeuroses form the anterior layer, leaving only transversalis fascia posteriorly, stabilizing the rectus for core strength and movement. Want to dive into its role in hernias or connect to the inguinal canal?
So the rectus sheath, where exactly is it? So explain to me also internal oblique aponeurosis and how it splits and why it splits to two layers, anterior lamina and posterior lamina. Tell me what lamina means. And tell me about the arcuate line too.
The rectus sheath is a tough, fibrous sleeve wrapping around the rectus abdominis muscle, running vertically along the front of the abdomen from the ribs to the pelvis, formed by the aponeuroses, flat tendon sheets of the external oblique, internal oblique, and transversus abdominis. The internal oblique aponeuroses, near the midline, splits into two layers, an anterior lamina joining the external oblique aponeuroses to form the front of the rectus sheath, and a posterior lamina, joining the transversus abdominis aponeuroses to form the back of the sheath, above the arcuate line to encase the rectus abdominis fully, splitting to provide balance, strength, and flexibility for core movements. Lamina, from Latin, means thin layer or plate, describing these thin, sheet-like tendon portions. The arcuate line, located about halfway between the umbilicus and pubis, marks where the posterior lamina of the internal oblique and transversus abdominis stops. So below this line, all aponeuroses shift to the anterior sheath, leaving only transversalis fascia behind the rectus, likely an evolutionary trait to reduce bulk in the lower abdomen while maintaining strength. Want to explore how this setup relates to hernias, or dive into the inguinal canal's connection to the sheath?
Tell me again.
go over the rectus sheath, internal oblique aponeuroses, lamina, and arcuate line again, keeping it simple and clear. The rectus sheath is a fibrous sleeve around the rectus abdominis muscle, located along the front midline of the abdomen from ribs to pelvis, made from the aponeuroses, tendon sheets of the external oblique, internal oblique, and transversus abdominis. The internal oblique aponeuroses splits into two layers, above the arcuate line, an anterior lamina, merging with the external oblique to form the front of the sheath, and a posterior lamina, joining the transversus abdominis for the back, to fully enclose the rectus for strength and core stability. Lamina means thin layer in Latin, referring to these flat, sheet-like tendon parts. The arcuate line.
Yeah, the arcuate line.
Kütlei könnte sich auf verschiedene
Hey,
Dinge
dude,
beziehen.
didn't we say we only speak in English? Okay, and I think Grog is tired, guys. Let me change its chat. Usually. Alright, Grog, we're doing a podcast. Let's talk. Remember, only speak to me in English even if you hear other languages, and please try to keep your sentences to 2 sentences per message. Having said that, let's talk a bit about the rectus sheath more. So we have anterior rectus sheath, and we have something called arcuate line. I want to understand what this arcuate line is, and I want to understand also the aponeurosis.
The arcuate line is a horizontal line on the anterior abdominal wall, roughly halfway between the umbilicus and pubic symphysis, where the posterior layer of the rectus sheath ends, leaving only the anterior layer below it. The aponeurosis is a flat, tendinous sheet formed by the abdominal muscles, like the external oblique, internal oblique, and transversus abdominis, which fuse to create the rectus sheath that encloses the rectus abdominis muscle.
So what's the difference between arcuate line and the other one, linea alba?
The arcuate line is a horizontal boundary where the posterior rectus sheath ends, leaving only the anterior sheath below it. The linea alba, on the other hand, is a vertical midline structure formed by the fusion of aponeuroses from both sides of the abdominal muscles, running from the xiphoid process to the pubic symphysis.
Okay. Let's talk about the actions of the muscles of the abdominal anterolateral wall regarding compression of abdominal contents, flexing the trunk, lateral flexion of the trunk, and trunk rotation.
The abdominal muscles compress abdominal contents, with the obliques and transversus abdominis primarily stabilizing and increasing intra-abdominal pressure. Rectus abdominis flexes the trunk. External obliques aid in lateral flexion and rotation, and internal obliques assist in lateral flexion and contralateral rotation.
And why is these specific muscles for these specific functions? How do the structure relate?
The rectus abdominis, running vertically, flexes the trunk because its fibers shorten to pull the ribcage toward the pelvis. The obliques, with diagonal fibers, enable lateral flexion and rotation due to their angled orientation, while the transversus abdominis, with horizontal fibers, compresses abdominal contents by tightening the abdominal wall.
Okay, let's talk about compression of abdominal contents a bit more. So let's talk about breathing, about holding our breath.
Compressing abdominal contents, especially by the transversus abdominis, increases intra-abdominal pressure, which stabilizes the spine and diaphragm during breath holding, like in heavy lifting or the Valsalva maneuver. This compression restricts diaphragm movement, helping maintain a rigid core while holding your breath.
Mm-hmm.